The next couple months are going to be really difficult.
COVID-19 cases surging in Michigan, forcing Covenant Hospital to suspend routine visitations again.
But at this point, it's just we have to look at the health of our all of our patients, all of our visitors, all of our staff.
Michael Sullivan, the hospital's chief medical officer, says these visitor restrictions, which only allows one healthy visitor despite some exceptions, is enacted to mitigate the spread of COVID-19.
Now, any of these exceptions, all of these patients have to be healthy. They go through a screening process at the door. We ask certain questions for symptoms, for temperature, things like that.
Sullivan says there's an upward trend of hospitalizations, which could put a demand on the hospital's resources and staff.
As we see more COVID patients here at the hospital, it hinders our ability to then treat patients who need care for other things.
He believes the second wave we suspected in the spring is finally here.
The patients that we're seeing in the hospital still are in the elderly age brackets. We saw the same thing in the spring.
But Sullivan suggests tracking COVID-19 cases isn't all doom and gloom.
The one thing we haven't been seeing is an increase in mortality rate. So I think that's a good thing. But that still doesn't mean that we can be cavalier about this.
In Saginaw, Blake Keller, WNEM TV5.